is Destiny Ulrich, and today I'm going to be assisting my DVM in prosection of a non-preserved animal for necropsy procedures. So I have our patient here. I have checked the signalment. We have a 2-week-old domestic short hair, gray, male intact kitten. He was orphaned at 5 days of age and passed away just this morning. He's the 4th kitten in the litter to die. Before he was deceased, the patient began sneezing and coughing, vomiting, and having diarrhea. The symptoms appeared 2 days prior. So I can go ahead. We have not seen this patient before, so we don't have any patient history or a clinical diagnosis, or any laboratory data to go along. But I can go ahead and perform an external examination. So body condition score. His ribs are easily palpable, and he's not emaciated or anything like that, so we'd probably rate him about a 4 out of 9 body condition score. If I go along and look at his mucous membranes, they're a little pale. Teeth. He doesn't have many teeth yet as he's a kitten. Cheeks, those look okay. The gums, they look okay. There is some ocular drainage, so we will note that. General conformation, there's nothing that seems abnormal with his conformation. Skeletal seems within normal limits for a kitten his age. Hair coat, again, nothing abnormal to note. No parasites, external parasites seen. No lesions, superficial lesions that we note. And I believe that is everything, so I'll go ahead and place him in dorsal recumbency. Okay, now we are ready to perform our necropsy procedure. So my DVM will begin to prosect.
I'll send it a little bit there. To the abdomen. Okay, where's your... trachea. Now, what do you need to identify them at this time, or?
I can identify them at the
Okay.
end.
Oh, at the end, just okay.
Just so I kind of have everything exposed.
Okay, so the trachea. It's gonna be a little tough. The suprascapular lymph nodes are gonna be a little hard to.
Well, if they're too small, I just need a general area.
General area where they should be. Do you have to identify the heart? Yep. The costochondral junction is, maybe it's more up in there. I'm just going to cut right on.
I need like a tripod that'll go like up and over.
Here's his diaphragm.
I guess I am.
The heart. So this is his left heart. These lungs, look how these lungs are.
Ooh.
There's a bunch of mucus and pus. This lung. That's pretty healthy, but that's pretty healthy. this lung, would be his right lung.
Okay.
And I think this in here is the thymus. It's a immune lymph tissue that goes away.
Okay. So right lung lobes.
Well, here they've got
Some hemorrhage.
some hemorrhage in them, and this one's discolored and badly discolored. This one looks pretty good. That one's got a lot of contusions in it. That one looks pretty good. Okay, so go back here, right?
So now we're entering the abdominal cavity.
And this is what is this?
Male. Just the bladder.
Yeah. The ureters. Let's do this. The liver. And there's the green is bile in the bile duct. It's leaking out. And then the esophagus.
Kind of buried down in there.
It is. Is that it?
Oh, yeah.
Not be yet. And then the fundus.
Yeah. Pyloric
Pyloric.
region.
Yeah. Pylorus, and then the duodenum. And then the duodenum, that's pretty inflamed. And it goes down the right side and then bends back into all the small intestine. And that's swollen lymph nodes.
So the duodenum is inflamed.
Yeah. And there's over here is the right kidney. Right kidney. So there is that should be the vena cava. And the adrenal gland's gonna be.
But they said cranial to the kidney, so right.
It might be right. Well, cranial to the renal artery,
Oh, okay.
vein and artery. So that's, let's go together. So there's all the small, and then there's the mesentery, and it's got a lot of chyle in it, or lymphatic tissue. Probably because, I don't know, maybe because he wasn't, I don't know. Maybe
So
'cause he
that's
was-
not normal.
I think it means there's a backup of it. Is this is still more the spiral. This is more the small intestine. And then here, the small intestine goes into the cecum, which is like our appendix. And then that goes into, where does that go into? It's a bladder. Well, here's the descending colon. And then this goes back up here. And we get into the trans. Is that the cecum? That's the cecum. Well, there's ascending, there's the transverse, and then right there's the cecum, and then it goes into the small, these are all small intestines. The large intestine's pretty small. Yeah, because it turns into the large intestine. There's the spleen right by the stomach. And then there's some pancreas. There should be pancreas. That's the left branch. There's pancreas. Oh, where's the pancreas here? Yeah. That might be the adrenal gland. It lays right on top of it. I think that is it. So then, this looks kind of crappy right here. The pancreas, this should be pancreas. And then the pancreas wraps around over to here. It's kind of weird. I don't know if that is pancreas. So there's the aorta and the vein. And then there's the kind of the shepherd hook appearance. And is that the, there's both kidneys. It looks awfully big to be the adrenal. But that might be the adrenal. I don't see much pancreatic tissue though. So there's that. There's the bladder and the colon. And then the prepuce back here's hard to see. So you lift this up and you should see the spermatic cords. And that might be that's teeny tiny. That's it. That's a spermatic cord. See?
Oh, yeah.
So if you can't find one, there it is. Oh, those are teeny tiny cords. See there? Do you see the testicle? So that's how you find them when you can't, when they're cryptorchid. So, geez.
So as far as the pancreas, do we think that it's...
Well, what's we got here? The pancreas should lay right next to the stomach here. That's probably, it's real delicate tissue, that's it.
Okay.
It's real delicate. That doesn't look like adrenal gland. Let's check over this other kidney again. Oh, I think that's it right there. That's it. The adrenal gland's right there. Gosh, no wonder you can't ever see the darn thing.
Yeah.
And it's really, its consistency is like the pancreas and the adrenal glands are really, are not very dense. So they're hard to see with the ultrasound, but I think that's it. Now the other one, there it is. Well, that may be an abnormal shaped one because they lay kind of opposite of each other. One is like Mr. Peanut and one's like a lounge chair. I don't get that though on these. I don't see a Mr. Peanut.
So an abnormal left adrenal gland?
Yeah. Well, I'm thinking it's abnormal. So then this is where the aorta splits into the femoral arteries. And right there is where male cats get a saddle thrombus right there that paralyzes them. And then I was looking for the lymph nodes up in here. Sometimes it's better to have a bigger patient. I don't think that's it. No, yeah. That's kind of the location of the lymph nodes.
So as far as popliteal, I need them exposed.
So there's our stifle. And the popliteal sesamoid bones. Should be right there. It might be. Let's go the other side. It should be right back there though. There's his knee. So it should be right in there. If that's it.
Yeah.
I think that's it. That's right where it should be. And we know it's going to be tiny.
Mm-hmm.
That's it. That's it. Okay, now what else do we need?
Probable cause of death.
Oh, brother me. Well,
It does have leakage coming from the nasal cavity.
I think that's... Let me see here. So this is the pericardial sac. I'll open that up a little bit. I don't think that's pus. That's just, I think that's part of the thymus, because it's a big tissue through here, and then it recedes as they mature. I thought we had some lung pathology and some atelectasis of the lungs, but this don't look so bad. He did have, looks like an enteritis inflammation. The kidneys, without opening them, I mean, look pretty good, and the spleen looks good. We did have a lot of inflammation there in the small intestine. I think we do have kind of a little bit of a mottled appearance. Some of that might be some post, and this lung is pretty hemorrhagic. This is his right side. So this is the vena cava coming back into the right side of his heart. And then or is that the aorta coming out? There's the vena cava going in there. This is the left heart. That's the aorta. And that's the esophagus right there. So I would say the cause of death would probably be pneumonia.
Back here at the roof of the mouth, we have the tonsils. It's kind of hard to see on this side, but they would sit right there. And so we go into, we can see the larynx is exposed right here. And then to either side of the trachea, we have the jugular veins, kind of small, and this is the trachea. And so going into the thorax, so we have the heart, and then the pericardial sac, which we have incised into. Our lungs sit to either side. Are you still recording? Okay. So our tongue, the mandible, and then the cranial vena cava. And so we can, then this tissue right here would be our diaphragm. And then our caudal vena cava right here. And then the esophagus is sitting below that, or above that technically. So that structure right there. So then we go into the abdomen and we have the liver, all the lobes, as well as the gallbladder. Our stomach sits right up against the diaphragm. So this section right here would be our pyloric region. Our pyloric region to our duodenum. The duodenum goes into the jejunum, so all this spiral, and the mesentery is going to be all of this. And so we go from the jejunum into the ileum, and then we have our cecum, and then we have our colon, this section. And then right at the canal, it goes into the rectum. We have our urinary bladder here. Each of our kidneys, we have a right kidney, and then the left kidney. So our adrenal glands, can you see this, Sid? Mm-hmm. Would sit right in here for either kidney. Okay, and then our spleen, this structure underneath the stomach. The pancreas is right here.
Not beat up as much.
Yeah. Okay, what else am I missing? A little disruption of our omentum, but this is some of the tissue from that. Off of our kidneys, we have our ureters that will drain into our urinary bladder. Our spermatic cords are these small little attachments. Yep, right there. And then we obviously have the prepuce, which is kind of hard to decipher, but our prepuce and our testes back here. Okay. Our penis, since this is such a small kitten, it may be hard to expose, but it is going to sit in the prepuce or the sheath. And then as far as lymph nodes, so our mandibular are these structures right here. Our popliteal, or our, the superficial cervical lymph nodes, there's one there. We don't have this one greatly exposed. But it's going to sit just cranial to the scapula. And then our popliteal lymph nodes. This one's kind of damaged from the prosection, but it would sit right behind the kneecap. And also on this side, this one's a little bit easier to see. It is right there. The bronchi are what is going to come into our lungs. So this would be our bronchi. And then our aorta, let's see right here. If I can get my heart positioned appropriately. It's kind of hard to do with the pericardial sac still slightly intact. But the aorta is going to be right here.